In our Investigator Spotlight series, you will hear about investigator projects, how HHEAR experts contributed to the project's success, and how their project contributes to HHEAR's goals of expanding our understanding of environmental exposures and human health. Today, Dr. Catherine Karr, professor at the University of Washington in the departments of Pediatrics and Environmental and Occupational Health Sciences, and adjunct professor in the Department of Epidemiology, discusses her project, Dynamics of Exposure, Phthalates, and Asthma in Randomized Trials, or DEPART for short.
To briefly summarize the project, the HHEAR project that we conducted, we assessed exposure to phthalate chemicals in a group of farm worker children in Washington state with a repeat measures design. So the idea was to try to understand, does exposure to phthalate chemicals make asthma worse? At the time we were thinking about this study, there had been a few studies about phthalate chemicals and asthma in children, but almost completely done to answer the question, do phthalates cause asthma, or looking at phthalate exposure and yes or no of asthma in children. Our study design was a unique opportunity to look at effects of phthalates on children who already have a diagnosis of the disease asthma. And so we were able, with the HHEAR resource, to measure phthalates in a cohort of children who have asthma longitudinally over a year of follow-up. And our study question was, do children's exposures to phthalates affect measures of their asthma health? So things like symptoms and as well as biomarkers of underlying pathophysiology, such as oxidative stress and inflammation.
How did consultations with HHEAR experts contribute to your project?
The development of our project really was embellished by our conversations, mostly a slew of emails back and forth between Dr. Babadi, my doctoral student at the time, and my staff and myself with the resources at the data center and the labs for the HHEAR resource. And, you know, I would say that those exchanges were really helpful and responsive to questions that we had and helped us kind of shape our plans. I want to call out a couple of people who were really notably helpful. Moira Bixby at the data center was very supportive, as well as Myra Heikkinen and Siam Andra at the Mount Sinai Hub. They, along with Dr. Bob Wright, encouraged us to think about, beyond phthalates, what other chemical exposures might be useful for us to think about as part of our service consultation. Our biomarker specialist on our team, Dr. Ann Reeder, was really impressed with the time that the lab hub took to go through the laboratory QC in detail so we could understand the accuracy and precision of both our measurements of phthalate metabolites in urine as well as oxidative stress and inflammatory biomarkers. We ended up with a expanded list of exposures interests that could be characterized, including pesticides and the organophosphate flame retardant. These were exposures that, you know, we developed in consultation with the HHEAR resource.
How will your HHEAR project advance our understanding of the influence of the environment on human health over a lifetime? And have you been able to publish your results?
We've been able to publish a couple of studies. The main studies that we set out to do with the HHEAR resource opportunity, and these were both a core part of Dr. Babadi's doctoral dissertation. So the first paper examined whether measures of exposure to phthalate chemicals were associated with measures of pediatric respiratory health in children with asthma. And the main study question were symptom reports of asthma symptoms higher when phthalate exposures were higher, as well as were biomarkers of inflammation, specifically exhaled nitric oxide and urinary leukotrienes, elevated at times when the children had higher exposure to phthalates. Asthma is a chronic inflammatory disease, and both exhaled nitric oxide and urinary leukotrienes have been used as measures of disease in human studies, and they've been linked with asthma exacerbation. In that study, we found that the phthalate metabolites in urine in our children were associated with increases in inflammation measured by exhaled nitric oxide and urinary leukotrienes. We did not see associations with the subjective reports of symptoms. Overall, this study really was important in adding to the limited data on the role of phthalates in asthma exacerbations, and specifically being the first, to our knowledge, to use a repeat measures design of both phthalate exposures and asthma morbidity in a rural population, and to incorporate these measures of urinary leukotrienes, which are a relatively novel and promising biomarker of airway inflammation that is sensitive to subclinical changes in airway health. The second paper we published, thanks to the support of the HHEAR resource, was a first authored paper by Dr. Ryan Babati looking at the association between phthalate exposure and two biomarkers of oxidative stress, one representing oxidative modification of lipids and the other nucleic acid damage. At the time we did this study, few studies have examined the relationship between urinary markers of oxidative stress and phthalates. And to our knowledge, this was the first one done in the United States, and to use this repeat measure design to evaluate in a cohort of kids who already have the diagnosis of asthma. In this study, we observed positive, statistically significant associations linking urinary phthalate metabolites with higher biomarker levels of both oxidative modification of lipids through the measurement of 8-isoprostane, as well as oxidative damage to nucleic acids. And again, the consistency of the association was notable, particularly for the biomarker of lipid peroxidation, which suggested this may be a really important biomarker to include in future research to understand the influence of phthalates on measures of asthma-related morbidity in children with asthma.
Would you recommend HHEAR to other investigators?
I would definitely recommend the use of the HHEAR resource to others. It really, for us, provided a tremendous opportunity to extend the contributions from our parent study and make the most of the investment that was already there. Certainly for my trainee who was involved, this provided a really optimal opportunity for analysis of samples for data to use in his dissertation, and provided an excellent experience in terms of what is, involved in sample processing and data analysis for an environmental epidemiological study using biomarkers of exposure and biological pathways of toxicity.
To hear more about the other investigators, check out our interviews with individual investigators in this Spotlight series. Thank you for watching.